Okay, we are ready to talk about cognitive decline. Do you find yourself going into a room and going, why am I here? And walking away and going, I remember now, and going back and go, oh, why am I here? Does that happen to you? It happens to a lot of us. Is it the start of dementia? How do you know what's really, truly happening to you? So we're going to talk with Dr. Stephen Grable of the Complementary Care Center in Jacksonville Beach, Florida, which is worth the drive wherever you're at. And we're going to talk about how to prevent cognitive decline and reverse it if you are in that place. So fasten your seatbelts because we're going to learn and grow together. It's time to dance, Dr. Grable.
The Lillian McDermott Show.
We love, we fear, bridges we burn, we make mistakes, then we live and learn. When life gets tough, and it seems like your best ain't good enough. If you're in need of hope, you know where I'll be right here, right here. And when you need a friend, you can count on me. I'll be right here, waiting for you.
This is the place you can always turn to when you need a friend. The Lillian McDermott Show. To reach out to Lillian, visit her on the web at whenyouneedafriend.com. Now let's all learn together. Here's Lillian McDermott.
Hello, my listening friends and viewing friends on Facebook.com/Lillian's radio show. I'm so glad we can meet each other on the air on this beautiful, best day ever. And for those of you who have been tuning in to the classroom since 2011, I'm so grateful to you. If you tuned in yesterday for the first time, I am grateful to you. But if this is the first time that you've tuned into the classroom, because somebody said Dr. Stephen Grable is on, we're going to be talking about mental brain health and that the care that we need to have for our brains, then please know I've been waiting for you. This is a safe place where you can go to when you need a friend. It is my commitment to provide alternative ways to heal, and it is my mission to make awareness, responsibility, and truth a part of our everyday life. And I hope you, my listening, as well as my viewing friends, will feel empowered to embrace a new truth and live the life of your dreams. Now, as you know, I talk about my sponsors all the time. And Dr. Stephen Grable is one of those sponsors who have taken a stand and said, we believe in this program. We believe in the information that is being shared. We want to empower you, the viewer, the listener, the person who is a seeker, a curious student of life. And so I want to thank Dr. Grable for taking a stand along with the classroom, the Lillian McDermott Radio Show classroom. So today, Dr. Grable, where you could find him at drgrable.com, and he's in Jacksonville, Florida, has decided that we are going to talk about cognitive decline, our brain, how to support our brain health. Now, how many of you take your memory for granted? How many of you, and I say me too, when I say you, I'm included in us. How many of us, how about that? How many of us find ourselves forgetting things, like having like you call it, a senior moment? Is it really a senior moment? Is this the start of dementia? Is this the start of Alzheimer's? Is this the start of cognitive decline? And so with that in mind, what can you do? What can we do to prevent? Well, fortunate for us, Dr. Stephen Grable is in the classroom. He is integrative, complementary, functional, holistic. He is a Swiss Army knife of MDs that have crossed over and said, I'm going to take the best of the East and the best of the West. And you can find him in Jacksonville, Florida. And the number for Dr. Grable is 904-247-7455. And since it is our sole purpose in life to give and receive love and knowledge, I am grateful that Dr. Stephen Grable is here to do just that. Welcome back to the classroom, Dr. Grable.
Hi, Lily.
I am so grateful that you're here. So let's get started because, there are so many people that do not, that take their brain for granted.
Mhm.
Let's talk about what happens if all of a sudden our brain starts to malfunction.
Well, usually it's kind of a gradual process, and it's a little tricky sometimes to understand between as we get older. Sometimes you may, not remember a name like you used to, or maybe
Mhm.
forget a number. That's kind of almost a normal part of aging. But we're finding that as the population gets older, we're going to see more and more cognitive decline. And there's a test that people can do called the Montreal Cognitive Assessment Test. And you can look that up online, and you can have a loved one can administer to another one. They're pretty simple. One of the first things that typically happens with more significant brain function loss is you start to have trouble with days and dates. That's one of the first things that tends to go. So, we're all, or many of us are stressed. That's one of the big problems today. And stress tends to affect a part of the brain called the hippocampus. And that's our main memory place. So that's one of the biggest things to look at, is to try and help to get some of the stress down. And we can talk a little more about that.
Yeah. And of course, the hippocampus is a very important part of our brain, and what we can do to kind of expand on it as opposed to have it shrink a little. So as we are looking at, cognitive decline, it might be stress. It might be that we're not consciously doing, that we're mindlessly doing things and not really paying attention. But it could also be the start of dementia or Alzheimer's, or perhaps maybe medication interaction. We don't know.
Right.
So how is it that how does someone determine if they do have, because I've heard statistic that 70% of people that are diagnosed with dementia or Alzheimer's don't have it. What they have is something else that's causing it, like diabetes or, poor stress and all that. So how can someone know for sure that this is their diagnosis?
Well, I'll tell you that the spooky thing about all this is Alzheimer's per se, or severe dementia, often doesn't really manifest till you've lost about 90% of your neurons, which is kind of scary. So I think that, if you start to feel yourself slipping, I'd get in and see your doc and have them do some assessments to figure out if you're starting to go down that path. Conventional medicine really doesn't have anything to offer. The medicines that are out there, they're pretty worthless. There is a book that I recommend by Dale Bredesen called The End of Alzheimer's. And this is really a big subject. In fact, we were talking a little bit before we started tonight that we could talk for easily 6 hours on this and still not even really get into depth. So I think that helping your listeners to understand that inflammation is really the key. So if you can remember inflammation, and then remember that your gut is intimately connected with your brain. So, you've heard this term called the microbiome, which is sort of all the whole milieu of bacteria in your gut. There's about 1,000 different species of bacteria down there, and many different strains. And these bacteria perform all kinds of functions. And one of the things is they tie in very closely with the brain. So when you're talking about getting your brain healthy, you really need to start in the gut. So, we always kind of get back to diet and exercise and things like that. We almost get tired of hearing this because we've heard this so many times, but it is really crucial to work on really cutting down on a lot of for example, your processed foods. Because when you look at inflammation, which is the normal process your body has to fight infection or fight trauma, if you're chronically inflamed, that's going to cause neuroinflammation in your brain. And we've talked before at some of the talks about Russ Blaylock. He's a former neurosurgeon. He's written about, he's got a book called Excitotoxins, which is really good. And he writes about, neuroinflammation and how these different triggers like MSG, for example, can cause a persistent inflammation in the brain. And we believe that this is one of the key factors in causing amyloid. You probably heard of amyloid plaques and tau proteins, sort of like this scar tissue that forms in the brain. And we think that that's secondary to inflammation. So I thought we could maybe take a few minutes and maybe just talk a little bit about some of the causes of inflammation, because there's some things that you can do, to try to help reverse that.
Mm-hmm.
So one thing is, I would suggest that everyone, especially if you're starting to feel like you're slipping a little bit, is to try off gluten.
Mm.
And gluten is hidden in everything. It's basically wheat, oats, rye, barley. And this can cause, in a large number of people, can cause inflammatory problems in the brain, as well as problems in the gut. So what I would do is try going off wheat, oats, rye, barley for at least a week, and then test a big dose of it and see what happens. Have like maybe a couple bowls of cream of wheat.
Mm-hmm.
And usually your body will give you a pretty clear answer in a couple of hours. So that's a real biggie.
But if you're feeling well after 2-3 weeks of going gluten-free, because like you said, gluten's in everything.
Right.
But if you go gluten-free and all of a sudden you're getting your memory back, would you want to go back to test how you do?
Oh, no, of course not.
Okay.
I'm just saying if people are unclear as to whether they might be having a reaction to gluten, because, sometimes to say to somebody, well, it's real easy to make these pronouncements, go off gluten, and yet when it comes to real life, that could be a real challenge because, a lot of moms, they're feeding their families and, to go gluten-free is a bit of it's an initial challenge, but there's a lot of gluten-free products out there now.
Oh yeah. When I went gluten-free in 1998, there was nothing. I had to read every label, and people need to understand that there's gluten in makeup, shampoo, care products, beauty products. There's gluten in a lot of things. So going gluten-free orally may be just one part of it, right? Because anything we put on our skin can be absorbed into our body.
Right.
Is that the same with gluten?
Absolutely.
Okay. So getting off of gluten, okay, so that causes inflammation in the gut, and that in turn causes inflammation in the brain?
Yeah, anything that causes inflammation in your body can inflame the brain.
Okay.
And there's a part of the brain called the blood-brain barrier.
Mm-hmm.
And the blood-brain barrier is very similar to the intestinal barrier. Your intestines are basically a tube. And it should be kind of a semi-permeable tube where you can absorb nutrients, but not absorb larger molecules and toxins and things like that. So most of us have heard this term leaky gut.
Mm-hmm.
And so people that have sort of a leaky gut or a more permeable intestine will tend to have more of kind of a leaky brain, which can create problems. So again, it all goes back to getting the gut healed up.
Okay. So what else do we have that we can use to reduce inflammation?
So a big one is to cut back on refined carbohydrates.
Okay.
So that's basically all of our sugar. And studies have shown, it's really fascinating, when they look at biopsies of Alzheimer's brains, 100% of them have problems with insulin. And there's now a thought that Alzheimer's per se is really sort of a type 3 diabetes.
Yeah.
So getting off the refined carbohydrates and onto more plant foods, that's going to help an awful lot to help reduce inflammation. Okay. And one of the tests that you want to have your doctor run is a blood test called an HSCRP. This stands for highly sensitive C-reactive protein. And I run these on all my patients. And it's very interesting how often, someone can look healthy and their level will be 5 or 6 and it should be less than 1. So we'll know that their body is very inflamed and we need to work on that.
And what is that test again?
It's called a highly sensitive or cardiac CRP that stands for C-reactive protein. A lot of times they abbreviate HSCRP for short.
Okay.
And your doctor can order that. It's a simple test. It's, Quest, LabCorp, they do those.
Okay.
That's a really good test to do.
Okay.
We all have heard of trans fats.
Yeah.
A lot of people, they hear this expression, not quite sure what this means.
Yeah.
So if you look at fats, if you have a fully saturated fat, it has a bunch of carbons in a chain,
Mm-hmm.
and every spot is filled with a hydrogen. So a fully saturated fat really cannot become technically a trans fat. But if you have double bonds that are scattered within that fat,
Mm-hmm.
and if that fat is heated or processed, it can twist, and that becomes what's called a trans fat. What happens with that is that really gunks up your cell membranes.
What are some examples of trans fat, or do you just see trans fat and not have it?
So anything that says, if you see partially hydrogenated or hydrogenated oil on the label, run. So when you go to the store and there's that whole row of oils, most of those oils in there are not good, because the food industry learned years ago that if they heat process these oils, they will last decades. Otherwise, you have to keep it in the refrigerator.
So that's why we want to buy cold press.
That's why you want to buy cold pressed. And interestingly, extra virgin olive oil, which can sit at room temperature, is a cis or non-trans fat oil.
Okay.
The problem is if you can saute lightly with it, but if you heat it to high temperature, it's going to become a trans fat. So I usually like to use coconut oil, if I'm going to do any kind of, I don't fry, but if I'm going to
saute,
heat up some eggs or something, I like to use coconut oil.
Yeah. Okay. Well, that's a great tip. That's a great tip. So what else is something that we need to avoid to reduce inflammation?
Stress is inflammatory. You wouldn't think there would be a connection with that, but there is. And there's a great book that I recommend all day long to my patients called Feeling Good by David Burns. And David is a student of Aaron Beck. Aaron was the guy who developed cognitive behavioral therapy, which is considered to be sort of the standard now in psychotherapy.
Mm-hmm.
And this book's nice because you read a couple of pages and then he'll give you little homework assignments. And so you can learn how to change your viewpoint. I don't know, you're familiar with the Four Agreements, I think.
Absolutely.
Don
Yes.
Miguel Ruiz. Yeah, it's
Yep.
an ancient Toltec wisdom.
Mm-hmm.
And interestingly, two of these four, these have been passed down for millennia. Two of these four agreements are: don't make assumptions and don't take anything personally.
Mm-hmm.
And isn't it interesting how often we make assumptions about things? Somebody looks at you a certain way and we'll concoct this whole story in our head.
Yeah.
Or someone will say something and we'll become so wounded. This is the kind of stuff that just really inflames our bodies. So if you can learn, and it's a process I always talk about just observing. So it's kind of like going to a movie theater and you just kind of watch, when you're in the movie theater, you watch it on the screen.
Mm-hmm.
You don't get into the movie. You just kind of watch the movie. And you get out of there and you go, boy, I'm glad I wasn't in that thing.
Mm-hmm.
Well, it's the same way in life. So if you can learn to just observe things that are going on, and I use the analogy of, imagine you go out in the kitchen and your kids have just had a food fight and there's mashed potatoes all over the walls and ceiling. Well, you can get upset and you can scream and yell and you can carry on and you could be miserable the rest of the day. Or you can kind of go out and go, oh, that's interesting. And you just clean it as you would brushing your teeth.
No, your kids will clean it, right?
Oh, your kids will clean it. Yeah, there you go. Yeah, so I'm
go.
not saying you don't discipline your children, but you see what I'm saying? So you don't, it's just an event. It doesn't have to have an emotional impact. And it's a lot easier said than done.
Yeah, it is. And there was a quote that I read. It's from over a year ago, and I'm hoping that I say it correctly. But it says, emotion like sadness that is not released through weeping will cause other organs to weep. So what you're saying, I mean, isn't that was said over 100 years ago. So even back then, it's not new that when we suppress emotion, and we do not deal with it through weeping or whatever it is that we need to release it, that our other organs will be affected.
Right. Well, that's true. But what I'm also driving at is if you can learn and through practice, learn to change how you think about any given situation, then it's the thinking, and this is what Aaron Beck showed with cognitive behavioral therapy. It's your thinking that causes you to feel a certain way.
Sure.
And so we can learn, I mean, you can get Aaron Beck's workbook and stuff. It's pretty deep, and I think the Feeling Good book is a great place to start.
Very good.
And,
That's a great tip.
Believe me, I don't have all this stuff down, but God, I'm sure will challenge me tonight on some level.
Well, what I love of what you're saying is that we can, avoid these things like, you're talking about carbs and getting off gluten and trans fats and managing your stress, and you're doing it, but you're also giving us something to do about it to be able to reduce inflammation. What are some of the substitutes that we can do? There's so much out there now, and awareness is key. So what are some of the other things we need to be aware of, Dr. Grable?
Okay. So kind of continuing our inflammation talk, lack of exercise, believe it or not,
Okay.
inflammatory. So when you mention exercise to someone who's sedentary, they kind of get an image in their head of, sweating on the treadmill and being miserable and being achy and so forth. I just finished reading, I don't know, are you familiar with Frank Schallenberger? Have you ever seen his stuff? Frank's an interesting guy. He's an MD out west. You are so well
versed.
And he's been around for 40 years doing this stuff. And he wrote a book called Bursting with Energy. And Frank got interested in the mitochondria years ago.
Mm-hmm.
And so he tests oxygen consumption and CO2 production. He can actually tell people what heart rate is their optimal fat burning rate and things like that. Well, what's interesting is people that are sedentary, sometimes getting and exercising too hard is actually counterproductive. Because not to get off in the weeds here, but you tend to burn, instead of burning fat, you're burning glycogen, and you get achy and you feel awful and so forth. So sometimes his prescription is he just wants people to maybe do some light walking. So the best advice with exercise is just get started. So, if you want to go to the gym, just commit yourself to go to the gym. If you walk through the front door and you say, I really don't feel like exercising today, turn around, give yourself an atta girl, an atta boy. And the next day at the same time, you're back in the gym, right? You're going to do that for 2-3 times. Eventually you're going to say, I'm here. I might as well get on the treadmill. And before you know it, you're exercising 30, 40 minutes and getting a good workout.
Very good.
So that's the key.
It is important to do it, because first it's the thought, then it's the feeling, then it's the action. So if you're thinking, if we're wanting to improve our lifestyle, just wanting to improve it, just having the thought is not enough. We will have to feel like we want to do it, and then we do have to take action, because nothing, a lot of these thought people that say, oh, you just have to think it and that's all you have to do. No, that is not true. You actually have to get yourself there. I'm smiling because I was doing research. Tomorrow I'm interviewing Dr. Michael Greger, and he wrote a book called How Not to Diet. And one of the hacks that he has is something called, and perhaps maybe you can pronounce this better. It's called Trendelenburg. Yes. Yeah. So, and he was saying that when we are inverted a certain 15 to 30 degrees, it gives the body, the heart, it makes it feel like it's exercising. So that's a hack. Did you know that?
That's wild.
I know. I was so intrigued by this. I texted my daughter-in-law and I said, "Have you ever heard of this?" And so I was thinking when you were talking about exercise, it's so important to exercise, but if you can't move, this is like the inverted where your head is lower than your
It's kind
legs.
of my teeter inversion table.
Correct.
No,
I think I'm going to try that.
I have a VibraFit. I have one of those vibration plates at the office. I love this thing because you get on it, supposedly 10 minutes, you get a 1 hour workout. And that may or may not be true. But a lot of times at the end of the day, I'm exhausted mentally and I don't really want to exercise. But I'll get on that.
Yeah.
And I'm on that pretty much every day. And
anyway, I just thought I'd ask you because I thought that was so fascinating. I don't want to go to the gym. I think I'm just going to lay with my legs over my head.
There you go. Kind of like those machines, and when you get the pad around your butt.
Yeah.
Remember those?
I remember those.
I'm not sure those quite did very much.
Man, I used to work at a Holiday Spa when we had those things. Yeah. Any other tips for reducing inflammation?
Yeah, there's there's environmental toxins, which
Sure.
people hear about this stuff, and we're swimming in a sea of this stuff. So obviously you have to breathe, you have to live, but the best advice is just try your best. It's worth spending money for organic food, and try to avoid. There's different companies out there that have more natural cleaning products and things like that. And I'll give you a little tip. I heard Diedrich Klinghardt talk at a meeting about a year ago. And he was talking about HOCl, which is a hydrogen oxygen chloride molecule. And this is a really cool molecule because it has a nice ability to disinfect, but it is completely harmless and innocuous.
Really?
So
and where do you get that?
Well, you can buy it online. They're like $50 a gallon. And I thought, that's interesting. And then I found this machine called an Echo One. And it's just about $150. And you put in a liter of water, about a tablespoon or so of table salt, a little bit of vinegar, and 8 minutes later, you've got HOCl. And then they've got they got a potassium carbonate salt. They give you a little bottle of it with the machine, and you can make a degreaser. So I got these 2 spray bottles on my drain board. And so instead of using a lot of dish detergent, which, people don't realize, but you never get that stuff completely off your dishes. Think about that.
Yeah,
and
I understand.
We're ingesting this over and over and over. What is this stuff doing to our body? I mean, so I usually just use a vegetable brush, hot water. And if I have some, it's a little greasy, I'll use my little sort of natural degreaser thing. It's a little fun fact for you.
It's interesting that you would say that because it always, we're washing our plates with chlorine and fluoride, and then we're putting it in and we're adding the dishwasher, we're adding like a little tablet. We don't know what's in that tablet. But I will say, I need to acknowledge my sponsors really quick. Keep Me Safe Organics is from head to toe is what I use. Dr. Grable, I'm going to be going to Jacksonville on Monday. Yes, the 24th. I want to bring you some products that you can use because they're beauty products from soaps. Instead of using, like so many men are using like foam. What's in that foam? Shampoos, they have degreasers in their shampoos that make us dry. And I use Keep Me Safe Organics. And of course and we're going to be talking about this next week, but they also have a retail line called Lily Rose, and it's just absolutely phenomenal as well. So it does make a difference. Taking those toxins, I love the fact that that's one of your tips is to reduce the toxins, but I want to acknowledge, Keep Me Safe Organics for making that commitment, no synthetic, all organic. And so I just wanted to share that, and I'm going to bring you some. I'll
definitely check them out.
Yeah, I'm going to bring you some products so that you can try it yourself and see. And some of your patients may want to be doing that as well. Cool. But okay, so with that in mind, we need to be mindful of the products because once it touches your skin, it goes into your blood system, right?
Right.
And
Yeah,
if
I
there's
heard,
aluminum or anything to that effect, it's really not good for us.
yeah, it said don't put anything on your skin you wouldn't eat. Feel like.
Well, I haven't eaten Keep Me Safe Organics lately, but I'm sure it's delicious. Okay, anything else that you think causes
So if we
inflammation?
haven't beaten inflammation to the ground, one other one I think it's very key, and I'm sure this has come up in other podcasts you've done, is electromagnetic radiation.
EMFs. Yep.
So there's a company that I use called Energy Dots. And EMF, for those who aren't familiar with this, anything electrical puts off electromagnetic frequencies.
Mm-hmm.
And these can be very harmful to the neurologic system.
Yeah.
And so when you look at bedrooms, you don't want to have, I don't keep my cell phone in the bedroom. I keep it in the bathroom. So it's a good 12 feet away. And I tell a lot of my patients, even try shutting off the breaker to your bedroom at night.
Mm-hmm.
Just use a flashlight if you have to get up, use the restroom. But, Joe Mercola just came out with his book. He spoke at a meeting
EMF'd.
a few months ago. Yeah. And so there's tons of written about, and then we're getting ready to go to this 5G, which is really scary. So, we're being bombarded with all this stuff. And I was reading an interesting article, and they were talking about how if you look at EMF in cell culture, they do a lot of these studies on cells in petri dishes. Well, we know that stem cells and blood forming cells are very sensitive to EMF. They can mutate and cause damage and so forth. Whereas fibroblast cells tend to be very tough, and EMF really doesn't have much influence on them. So guess what the cell phone industry does their studies on?
Oh.
Fibroblast cells. So a lot of the data out there is really false in terms of what these things do to affect you. Lee Cowden, I know you're familiar with Lee. Mm-hmm. He had at a meeting a couple of years back, they did a study in a rat model where they exposed the rats to 1 2-hour dose, if you will, of cell phones. I guess they had little rat cell phones. And then about a month later, they sacrificed the animal, and they had literally holes in their brain compared to the control. 1 2-hour exposure. Now, the rat skull is much thinner than ours.
It'll go right through it, like a child. And children now,
with these things plastered to their heads hours a day. So I tell my patients, unless you want brain cancer, do not do this. You talk at speaker, or use like earbuds. I think we've talked about that. Lee, if he gets called on his cell phone, he will say, "I'll call you right back," and he calls people back on a landline.
Yes.
So anyway, it's not that we have to, go in a bubble and be biting our teeth, fingernail, but becoming aware of this stuff, I think is very smart.
Absolutely. It's about prevention, just awareness, and then we can mitigate all these different things that are in our life that we're not aware that are causing us issues. So with inflammation, that is very real. Inflammation is very real, and they're saying that inflammation is one of the main reasons people are sick. And that, again, going back to ground therapy, you and I have talked about ground therapy. Ground therapy helps with the EMFs. Ground therapy helps reduce inflammation. It's more than just removing it's the earth is a natural anti-inflammatory. 7.8 hertz, and you have a pulse electromagnetic bed in your clinic. What else do you have that helps with that, Dr. Grable?
Well, I'm on that daily, and I have I try to stick my feet in the wet sand, and I want to put a plug in for your earthing.com website.
Well, actually, they need to go to whenyounneedafriend.com.
Oh, when do you need a friend? Then go to earthing.com.
Yes, because we're having a problem right now. Because that's a way that I can get compensated a little bit for, to help grow the classroom. And if they go to earthing.com, they need to go to whenyounneedafriend.com and click onto the shop bag and then click on there.
Okay, glad I asked you.
So no, that's good. That's good. And
so the products are very inexpensive, and they're Robbie, your husband, I was very impressed at the meeting when he was showing with how when you just touch these things and you could just see the
change.
EMF stuff go right drops right down.
Yeah.
As long as your skin's in contact with these. So you can have these like at your computer station, put them at the foot of your bed. So if, as long as your skin's touching them at night, you can plug them into the ground and all this kind of thing.
Yeah, and we're doing a giveaway for St. Patrick's Day. We're giving away an earthing a Unimat. I have got one under my feet right now while
Cool.
we're talking, so that all the exposure that I have is coming off my feet. It's coming out of my feet because we have about 3,000 pores. And real quick, I just want to acknowledge, Dr. Stephen Grable. You can find him in Jacksonville Beach. And you can call him at 904-247-7455. You can also email Dr. Grable at drsgrable@gmail.com. And you can check out his website, either by going to my website at whenyouneedafriend.com, click onto my sponsors page, and then visit him there, because he has so many different healing modalities that he does. He doesn't stop at giving you a pill. He actually is like a medical detective. His MD not only stands for medical doctor, but it also stands for medical detective.
I like that.
As he helps you figure out the root cause so that it goes away. And this was what we're talking about with dementia and cognitive decline and reducing inflammation in the body. But I also have other sponsors. So if you go to whenyouneedafriend.com, please become a subscriber. And while there, support my sponsors, such as Liberty Health Share, Keep Me Safe Organics, First Alternative Care, the Pharmacy, Live Longer Medical, Ground Therapy, Brain Tap, and of course, Dr. Stephen Grable, and support them the way that they're supporting the classroom. And finally, you too can become an enrolled student in the classroom. How do you do that? You do it by buying some of the affiliate products that I have that helps with the classroom as well, because I keep sponsors, I get the prices as low as I possibly can so that we can grow. Look at that. We have a classroom behind us. Are you sitting in this classroom? Just know that this classroom is yours for free, but someone's got to pay for it. And so if we could all unite and figure out ways that support each other, that would be phenomenal. And if you can support Dr. Grable by, if you live in the Jacksonville area or live in the surrounding area, worth the drive. And Dr. Grable does Zoom meetings. He and I have met many times over the phone or on the internet. Speaking, the internet can be a wonderful thing, like getting a Zoom consultation with Dr. Grable, or it could hurt you. So that's why we have ground therapy and walking on the beach. And I love the fact that you said you stick your toes in the sand. So every day?
I try to get out there. I live,
Awesome.
I'm looking at the ocean right now. So I live, it's nice. I live on the ocean.
Yeah, yeah.
But yeah, you actually get electrons from, Steve Sinatra's written books on it. And
yeah, he's coming back in the classroom March 10th, I think he's going to be on.
Cool.
But he's wonderful. He's wonderful about talking about EMFs and ground therapy. So good for you. Or as I was told by but I'm trying to remember his name. All of a sudden, his name just escaped me. Good on you. Good on you. Okay, so let's talk about. Are we good with the inflammation and?
Yeah,
and
I think
other...
I think we've kind of beaten that.
Okay.
A little bit much. So I'm thinking with the time we have remaining, I'd like to try to give your listeners some good little tidbits.
Okay. So can we talk about real quick minerals and some of the minerals that we might be deficient in the brain that could cause the cognitive decline?
Yes.
Okay.
So some of your nutrients, your B12 and folate are very key. And so, folate, you can get that through your green leafies, but some people need to take supplemental folate. Folate is the natural form of folic acid.
Mm-hmm.
And I would encourage people, what I do is I do what's called a homocysteine blood test. And I was a little bit dismayed because it's kind of an expensive blood test, and we're having a lot of insurances are balking at covering. Well, I found, put a little plug in for life extension, but they offer one for about $54, which is really pretty good.
And that's homeocysteine?
That's the homocysteine, yeah.
Homo.
Yeah, HOMO, cysteine, CYSTEINE. So anyway, that's a functional test for B12 and folate. So I really don't like to do too many B12 or folic acid levels because I don't think they really give you an idea of what your status is. But if you're homocysteine, you want that down around 6.
Okay.
And so I see all the time, I'll see people 15, 20, which is very, very high.
That's a lot of inflammation. That's testing
Yes.
inflammation?
Well, homocysteine is a kind of a functional test for B12 and folate for what's called methylation.
Okay.
But homocysteine also affects blood vessels. It's a contributor to atherosclerosis, which, that can also be a factor in terms of dementia.
Mm-hmm.
But having good B12 folate status is important. Omega-3s.
Okay.
So go ahead.
I want to go back to the folate. I want to
Okay.
emphasize that when you're talking about folic acid and how it's a synthetic form of vitamin B, but it is a petroleum-based, right? Petroleum-based vitamin B. So if you see something, vitamins, if you have folic acid in your vitamins, replace them with something that's folate. If you're not doing the leafy greens, but if you're doing also folate, do folate. So I just wanted to acknowledge your
methylfolate, also folinic acid is a safe form.
Mm-hmm.
But yes, that's
okay.
Correct.
Keep going. I'm sorry.
So omega-3s, they're give you a little quick lesson. We hear about flax oil, which is fine. Flax oil is what's called ALA, that stands for alpha linolenic acid. You don't have to learn all these terms.
Okay.
But ALA has to be converted down to DHA and EPA. And interestingly, about 30% of the population have delta-6 desaturase deficiency, so they can't make that conversion. So I usually recommend either fish oil, krill, or algae-based.
Okay.
So just a little tip, fish oil, the only one I recommend is Nordic Naturals.
Okay.
Because the rest of them, even though they say they're mercury-free, very often are contaminated. So I don't have any connection with Nordic Naturals, but I just know that they really do a good job with that. So your omega-3s are very key to your membranes and for a healthy brain. And your vitamin D, be sure to get your levels checked. There's a lot of debate about D levels. It seems like one week people are saying, well, it should be around 30 to 40. The next week people are saying 100. I think a good middle of the road is probably in the 50 to 80 range, somewhere in that ballpark.
Okay.
And your doctor can order those tests and check them.
Okay.
So your folate, B12, D3, fish oil, those are really pretty basic.
Now with krill and algae, are they the same measurement as fish oil? Like if I'm taking 300, is that EPA, DHA? Is that what you're talking about?
Right.
If I'm taking those, is there a particular number for fish oil that has to equate a plant-based or algae or?
Yeah, generally you're going to be about like a capsule twice a day, typically with the krill and algae based. I think a lot of it depends on the different processing methods and things like that. They talk about 1,000 milligram of fish oil 2 to 4 times a day. So that's kind of in the ballpark of what we're talking about.
But 1,000 milligrams of fish oil that has low EPA or DHA is
fish oil is high in EPA and DHA.
Okay, so
flax oil, now that has to be processed down to EPA and DHA.
Okay.
So a lot of people are fine with flax oil. They will process it okay, but I have my Asira machine, so I'm always bioenergetically testing people, and it's a rare person that omega-3 and 6 deficiency doesn't come up.
Okay.
So I'm constantly promoting, your 3s and 6s for patients.
Okay, so 3s and 6s. What about the 9? Because sometimes I see 369. Is that the one?
Well, your omega-9s, those are like your olive oil. Your body can make omega-9. So as long as you have the raw, when you talk about essential fats, essential means that you can't produce it in your body. So you have to consume it.
So that's 3 and 6.
So that's your 3 and 6. So if you're getting your 3s and 6s, you can make your 9s.
Now, if you have, let's say, salmon once a week or every other week, is that enough? Or do you still need to have the omegas?
I would say if you're getting probably 2 fish meals a week, that should be adequate.
And you don't need to add
You
any
want your
more.
cold water fish, like your salmon, that kind of thing.
Perfect. Okay.
know.
Anything
Stay
else
away
that,
stay away from your high level fish. Even grouper, interestingly, is a bit higher in mercury. You kind of, because it tastes good, but grouper, tuna, you probably keep those to minimum.
yeah. Yeah. Okay. Anything else? What about
Well,
copper? What about copper?
So copper and zinc are
Mm-hmm.
very important to your brain. You can check levels of those. There's
Magnesium.
a rough estimate that Jonathan Wright used to talk about 1 milligram of copper for every 15 milligrams of zinc. So if you're taking 30 milligrams of zinc on a regular basis, then a couple milligrams of copper is not a bad idea.
Okay. And for those of you who are watching in the classroom at facebook.com/Lillian's radio show, if you have a question for Dr. Grable, this is your opportunity to ask the doctor. And he loves to answer your questions. So make sure you type in a Q and then ask your question after that. Okay, so with that in mind, there was something that when you were talking about exercise, it reminded me of when I went to the ACIM conference a couple of years ago. There was this group that was administering oxygen while you're working out.
Right.
So let's talk about oxygen, the importance of oxygen, and maybe ozone and all that, and how important that is.
Yeah, I just got a low pressure hyperbaric chamber for my
No
office.
way.
So I'm in that almost every day. Yeah, it's
How do you? I've never done that. How do you like it?
I love it. I feel good. It's interesting. About 20 minutes into, you just kind of go into like this zone. I usually just have to close. I usually am reading, but I usually just close the book and just kind of sit back and one of those things. But there's a thing called exercising with oxygen. So you can go online and you can find an oxygen concentrator. You get it for about $1,200–1,300, and you want one that is 10 liters per minute. And you can actually buy what are called non-rebreather masks. And these masks have a little reservoir bag on them. And what happens is the oxygen from the machine fills this little bag. So when you take a breath in, there's these little valves in there. You'll get a higher concentration of oxygen. And then when you breathe out, it just goes out the side of the mask.
Mm-hmm.
So you can get on a treadmill or do a stationary bike. And if you get your heart rate up while you're breathing in this oxygen, they call that exercising with oxygen. That's a great way to oxygenate your brain and your tissues and your mitochondria and that sort of thing.
Okay,
That's a great idea.
so what if the doctor, what about medications? I had mentioned before that sometimes medications can cause a reaction, like especially statins. There's a class action lawsuit because people are having dementia-like symptoms and it's their statin.
Right. And it's interesting, statins, you have to treat 100 people to have benefit in about one person. And if you read the book, The Truth About Statins by Barbara Robertson, she's a cardiologist, she shows, and let this sink in.
Okay.
There is no conclusive proof that primary prevention in women is valid.
Say that again.
You know what that means?
Primary prevention in women.
Primary prevention is preventing that first heart attack.
Okay.
You know how many, probably tens of millions of women are on statin drugs to try to prevent that first heart attack?
Oh, okay. So say that again. You're talking about statins for women.
There is no solid evidence that primary prevention in women is valid in terms of trying to lower cholesterol to prevent a heart attack.
Got it. Okay. Now I got
over
it.
the age of 60, the benefit from lowering cholesterol drops because studies show that in the elderly, those with the highest cholesterol live the longest. So you have to read between the lines with these studies because they might show a reduction in cardiovascular disease, but if you look at what's called all-cause mortality, that may actually go up. So I'm one of those black sheep that I could count on one hand how many statin prescriptions I've written over the years. And
They
I
are
know
dangerous. They are so dangerous.
cardiology is throwing fruit at me right now. But I just think it's a $30 billion industry. And I think we've really been kind of misled about all this, because we need cholesterol to make membranes and steroid hormones. I mean, it's much more important to look at heavy metals and sugar and all these things we've been talking about that damage the lining or endothelium of the artery. So anyway, we could get off, I don't want to get off in the weeds with atherosclerosis, but you're right. And there's other medicines too, and be sure to mention this to your listeners, because Bredesen estimates that roughly 15% of dementia is being caused by drugs, appropriately prescribed medications. So that includes antihistamines.
Ooh.
Because they have what are called anticholinergic properties.
Mm-hmm.
So that's a huge market for antihistamines. And there's a variety of natural things out there people can take instead of that, which we don't need to get off into today. But
Well, I'm sure people would want to know. Yeah. But
think
the best thing
it.
is to alter your lifestyle, right?
Right. But I mean, you know, with all the pollens and everything going on right now, things are pretty bad. Just to mention, vitamin C is an antihistamine.
Mm-hmm.
And quercetin, that's a nice flavonoid that you could take that can help to calm things down.
Quercetin?
Quercetin, Quercitin, quercetin.
Quercetin. Okay, quercetin is good. Of course, vitamin C, you know. Dr. Furman was on the other day, and he said there's no evidence that you need more than 60 milligrams of vitamin C. And of course, there's a lot of evidence that's out there. And I sent it to him, and he said that it's inconclusive, that there's really no proof. And I'm living proof that I was chronic asthmatic from the moment I was born. When I was 9 months old, I was hospitalized, and it was just got worse from there. And by the time I spoke to Dr. Andrew Saul, who is spreading the word of Dr. Linus Pauling, the work of it, and the website is called dryourself.com. All the different things that you can use vitamins for. We got to be careful not to substitute vitamins for pills. You know, we want to change our lifestyle primarily, but our body does not make vitamin C. Can you share a little bit about why, you know, higher doses of vitamin C are not harmful?
Oh, I've given as high as 150,000 milligrams in an IV in one sitting.
Yes.
The orthomolecular doctors, those are the guys, they're the real vitamin C pioneer. I've heard of patients being on 24-hour drips of vitamin C. Mm-hmm. If any of your listeners are interested, there were two docs, they're long passed on now, named Klenner and Cathcart.
Yeah.
And these two guys, some of the doses of C they used were just heroic, but Klenner, get this, he cured 60 out of 60 polio patients with IV vitamin C. And that doesn't even get mentioned. If that were a drug, it would be historical.
Yeah.
People would be jumping up and down and screaming, you know?
Yes. Well, Dr. Grable, this has been fun. I really have enjoyed this conversation because I think all of us can relate, even if we don't have dementia, you know, that prevention, that what are we doing that could promote it? We didn't even talk about ApoE. Maybe we can talk about ApoE, you know, after in the teacher's pet section. But is there anything that, you know, we've got 2 minutes before the podcast end. And by the way, if you're listening to the podcast right now, please join us live at whenyouneedafriend.com. Click on Facebook and you can join us there. When you subscribe, you'll know who's on. But what would you like to say about taking control back of your brain?
Okay. Well, three other groups of medicines that we didn't mention: benzodiazepines, your Xanax, Valiums, opioids, and antidepressants. All of those can contribute. So you need, if you're on any of those medicines, you need to talk, or you do some research to talk to your doc. You know, Bredesen showed that he reversed over 100 people, some with fairly severe dementias, back to preclinical levels. So this stuff is very reversible. The problem, if you will, is there's quite a number of parameters. Like I said at the onset, if we really got into this, we could spend a couple of days discussing all the things that are available.
Well, I wonder if we can maybe do part 2 of this, because, you know, if you are in that place where you have dementia, and my mom has dementia, and I wish there was something I can do, but they say, well, there's a point of no return. Is there a point of no return? And that's that's what we need to really stop the limitation of our belief. And I think that maybe we can talk a little bit about that after the podcast. So Dr. Stephen Grable, thank you so much. He is the owner of Complementary Care Centers in Jacksonville, Florida. Please reach out to him. Please remember, we'll be right here waiting for you worldwide at whenyouneedafriend.com. This is Lillian McDermott and Dr. Stephen Grable wishing you love, peace, joy, and unexpected abundance. Make it the best day ever.
The opinions and advice expressed on the Lillian McDermott radio show are intended for the individual callers and guests on the program and are presented to our wider audience solely for general educational purposes. Please act responsibly and consult personally with your own medical, psychological, or nutritional expert before taking any steps to improve your life.
Okay, Dr. Grable. Okay, so ApoE.
Yes.
ApoE is a test that we can see if we have a predisposition to dementia. We didn't even talk about that.
Right.
And which one is the one that if you get, because I have the one that I don't have the predisposition.
Okay, so you get one allele from each parent, and it's just numbers 2, 3, or 4.
Mm-hmm.
So you can be 2-2, 2-3, 3-3. 2-2 is the best, 4-4 is the worst.
Yeah.
Now, if you have the 4-4, that does not mean that you're going to get dementia. It just means that you're more predisposed. It's kind of like, the BRCA gene. Everyone's heard about that, the Angelina Jolie. But you know that 50% of women with the BRCA do not get breast cancer.
Yeah.
So there's a whole concept called epigenetics, and it's how your genes are washed in the environment. So even if you've been sort of blessed with unhealthy genes, you can still go on and live a long, healthy life. But obviously, if you did the ApoE testing and you were, 3-4, 4-4, you'd want to pay closer attention and do extra things to help prevent a problem.
Absolutely. And so, it's interesting that you said, okay, we could probably talk about this topic. I know that, I think it was last year, the ACIM conference, it was all about brain health, right?
Right.
And so what was your major takeaway at that conference that you just had to stop and take it in and say, oh my goodness? What was your biggest takeaway that even you, as an incredible physician and medical detective and all that you had to stop in your tracks and say, I didn't even know this. This is groundbreaking.
That's a very good question, Lillian. I mean, there's just so much. I think that probably the biggest thing that I have been learning and studying lately is the importance of the mitochondria.
Mm.
And for your listeners, to take some time and to learn about the mitochondria, I think would be a very prudent thing to do. I'm looking to see there's 30 or 40 different things people can take. Let me leave two things in particular that keep coming up over and over again in different newsletters and whatnot. There's one called Bacopa monnieri. That's spelled BACOPA and then MONNIERI. This can help. There's been a lot of studies on this. This can help to improve what's called cholinergic function. Acetylcholine is the main neurotransmitter that we use to conduct impulses in the brain.
Mm-hmm.
The other one is lion's mane, and there's some medical terms there. But those two, if people wanted to just get started on something to try to help, those would be safe that they could try.
So that helps brain function?
That helps with brain function.
Because I've heard of lion's mane. I haven't heard of the
Bacopa monnieri. Yeah, Russ Blaylock, he talks about that all the time.
Is that a mushroom as well as because I know lion's mane is a mushroom.
That's in the herbal family.
Okay.
It's not a mushroom. And then you've heard of ashwagandha.
Yeah.
That's an adaptogen. That's also gotten a lot of good
Yeah. It's
press.
good for the thyroid as well, ashwagandha.
Right. Exactly. We didn't touch on sleep. Sleep is just crucial, because one of the things that I was reading an article about deep sleep is one of the times that our brain detoxifies. It's like the brain is washed. There's actually, they figured out the brain actually tends to shrink at different times at night, allowing fluids to come in and just kind of wash and clean out.
Wow.
So, getting deep sleep is very key. Melatonin, that's we all make melatonin. It's our sleep hormone, but it's a good antioxidant, and I think probably just about everybody ought to be taking some melatonin.
Well, I read that melatonin can become not habit forming, but it would cause your body to stop producing it if we artificially took it.
You might get a little rebound for a while, but I mean,
Okay.
you're never going to stop permanently making it.
Okay, because I stopped taking it.
Yeah, but I take typically 12. Actually, I used to take about 24 milligrams a night, typically.
Yeah, I started brain tapping at night.
Doctor immediately prescribes.
I go to sleep like that, and I stay asleep with. It's called deep delta sleep. So
Yeah,
I'm going to brain tap you when I see you on Monday. I'm going to brain tap you so that you can experience that as well. I'm going to give you a little dose of that. But it's amazing how many things we can do. And I love the fact that you say that our genes are not our destiny. That is a template of what our life could become if we're not serious about giving our body what it needs.
Right.
And so it would be, it's wonderful that you've come here today to share some of the things that we can do that will help with our brain function. If somebody is like, so many times, like I went into the pantry this morning because I wanted to get my coconut milk for my blueberries. And I went into the pantry and I came out of the pantry and I thought, why did I go in there? I was like, why did I go in there? And then I saw the blueberries and I thought, need to go get my coconut milk, my coconut milk, because I like the simple, organic, canned coconut milk that I put on there so it doesn't have any gum, no thickening agent. And so I thought, we're talking with Dr. Grable today about this. Why is it that sometimes our brain malfunctions like that? Is it because we are so busy and are not mindful? And let's talk about meditation real quick and how important that is.
I think that's a big part of it. We just have too many things that we're trying to process. And, a lot of it, they talk about memory. They'll show that it never really imprinted in the first place. Something you may have heard something or may have crossed your vision, but it really didn't stick. Mm-hmm. So you really can't retrieve it because it didn't stick in the first place.
Yes.
There's a really funny video, and I was trying to find it the other day. It's this British gal. It's 4 or 5 minutes long, and she goes, the other day I never get anything done. The other day I went to wash my car and I went to the kitchen, and then she talks about how she keeps going down all these pathways of distraction. She says, at the end of the day, I got nothing done and my car's still dirty. And it's funny because we all go through this stuff, But I would say one of the things is keep your brain active. So, I do a lot of reading. Some people don't care to read, but there's brain teasers and there's all kinds of crossword puzzle stuff. But those actually have value. Sort of like your brain is kind of like a muscle. Mm-hmm. You never lose it. So I would encourage you.
Dancing is good. Dancing is good. Learning stuff. That's why I want you to dance when you come on the classroom, because dancing is really good for your brain, especially when you're learning new steps and when you're doing new moves. They say that brushing your teeth, if you're right-handed, brush your teeth with your left hand. There are different things that we can do to stimulate the brain as opposed to, like, I remember Bruce Lipton when he was on the show a long time ago, he was saying, you know, how do you know you have stopped being conscious?
Mhm.
And it's when you are talking. So when you're talking and you're doing something, let's say you're talking and you're driving, all of a sudden your driving skills have gone into your override subconscious mind,
Uh,
because if you were really conscious, you wouldn't be able to do anything other than what you're doing. Being
yeah.
conscious is really doing what you're doing. So anything that would require you to stop, because if you were to stop, you wouldn't be able, like learning a dance step, or, you know, brushing your teeth with the left hand. Now you're paying attention. And do you
Right.
remember that exercise at the ACIM? They asked us to put our thumb on top of the one, I don't know if it was at the ACIM conference, that if you have a predisposition of putting your thumb on the top, like if you put your hands like this,
It automatically kind of goes one way and then do
and
it the opposite way.
okay, and then they say, put the other side on top, and sit there and see how it feels. And then I think it was Patrick Porter who said, he said, okay, so do you know why you have a preference to the other? And the answer is, well, when you figure it out, let me know.
Well,
It's the
you've heard,
things that we do.
yeah. Well, you've heard of cross crawl. You know, when you walk, when your right foot goes forward, usually your left hand automatically swings out.
Yes, yes,
So what you do is you consciously have the same limb go out at the same time.
yes.
So when your right foot goes forward, your right arm goes out.
Uh,
It's weird when you first do it, because we're so used to, you know, kind of doing that opposite. But that actually, they call it the cross crawl. That actually apparently helps with some of the brain
Stimulate the brain.
functions.
That's
It
right.
actually,
That's right.
you
So
know,
those
things.
are the little things that we can do to kind of hack the brain, that will
Right.
help us develop a little bit more of that conscious. Because I kept saying to Dr. Lipton, I kept saying, you know, tell me, what can we do to increase our cognitive, you know, that we're like aware and present in the moment. And what he said was, we need to rewrite the program, because we're so much in the program
Right.
that we need to rewrite the program. So whether it's our thoughts, our behaviors, our feelings, all that, if we can rewrite it, then it will help us with our cognitive skills. And it's just amazing that we have the power, Dr. Grable, to do that. We have the power.
Right. Right.
So with that in mind, before we go, empower us to have a supportive brain, or support our brain, so that we can live a mindful life until we take our last breath.
Right. And I'll give you one little tidbit is coconut oil.
Mm-mm.
And I'm sure you've read about medium chain triglycerides, but these actually, 2 to 4 tablespoons of coconut oil a day is actually quite good for your brain. And there have been cases of people that not totally reversed, but have seen significant improvement just with 4 tablespoons a day of coconut oil.
Are you talking about MCT oil? Is that what you're
Well,
talking about?
coconut oil is basically MCTs. Yeah. So you
Yes.
could get MCT oil, or you could get, you know, just coconut oil. It's not
Yeah,
something
I was just looking at Victoria. Victoria saying she needs to rewrite the program. Yeah, we all do. We all do. So go ahead. I'm sorry, MCT oil. So now I saw a study that said that after 3 months, everything kind of became normal again. Is that, do you know anything beyond that?
What do you mean became normal again?
That
Or you
at
stopped getting
first,
benefit from it, or?
yes, that there's a really benefit for you know, after 3 months, and then after that it just plateaus. I don't know, because for every discovery there's an industry that wants to squash the discovery. You understand
Right,
what I'm saying?
right,
Because
right,
I don't want to say anything that'll keep us from promoting this class.
right, right. Well, you know, what I teach is, when you're talking about medicine, politics, or religion, is read lots of different sources. And, you know, what'll happen is, over time, is truth always keeps coming up. You know, you can't suppress it. You're going to have your outliers here and there, but in general, things that are true will continue to come up. And that's usually where the truth lies. So I think, you know, certainly MCT oil is no magic potion, But it's just one thing that people can do to try to help. And as Bredesen points out, usually it's probably 10, 20, 30 different factors in any individual that gives them the presentation of dementia.
Mm.
So the more of these things that you can intervene on, the better chance you have of reversing or preventing it.
Yeah. And especially with a statistic that just like blew me away, that 70% of cases that are diagnosed with dementia aren't real dementia. We're talking, so we talked about inflammation, we talked about, we talked about inflammation, we talked about medication interaction, there's so many different things, EMFs, things that we're doing to ourselves.
Right.
If you think about it, that anything that we can do to make a small little change, one step at a time, by the time you get through that little checklist of all the different things that we can do, perhaps we can reverse it. We could reverse the symptoms and become more active in our lifestyle. And the only way, unfortunately, to know if you had dementia or not is when you die, they slice the brain, right?
Right. Right. But you can also, an MRI of your brain, you can see if there's been significant shrinkage and things like that. But even with that, there have been many cases of people that even their pathology slides when they're dead, they're full of plaques and tangles and shrinkage, and they were normal clinically.
Mm-hmm.
So, there's a lot of stuff we're still trying to figure out about all the little neuron connections and all that stuff. So
basically, bottom line is do everything we can to take our health back, to take our
Right.
brain back, or take our power back, and the rest will follow. If we give our body, yesterday we had Dr. Lodi in the classroom, Dr. Thomas Lodi, and he talked a lot about, some of the things that we can do to take our health back. One of the things, I wanted to talk about this, was fasting. And the importance of fasting. Do you ever put your patients on a fast?
Oh yeah, I recommend all the time. So, they call about this intermittent fasting where you eat from 12 to 6.
Mm-hmm.
And most days I try to just, I'll have a little decaf in the morning. I try to not eat, but usually by about 10, I'm starting to get pretty hungry. So I have a little whey protein or something. But we can, if you allow your gut to rest for 18 hours, and in particular, we didn't get off into ketosis, but, letting your ketone bodies form, that's really good for your brain.
Yeah.
You can read about the keto diet and all that stuff. But
yeah.
I think that's, and they say, a water fast once or twice a week is very healthy.
Yeah, absolutely. Well, he actually said that fasting is truly not eating for 24 hours. Anything outside of that is restrictive eating. And and then 3 days, 72 hours is when the sweet stuff happens, when your body starts really repairing. And so a lot to talk about. Like you said, we could talk about this for 6 hours, and I really do appreciate you. Again, Dr. Stephen Grable, if you have any questions for Dr. Grable, you could either send them to me and I will forward it to him, or you can email him at drsgrable@gmail.com. And again, you will find him in Jacksonville Beach, Florida. Worth the drive if you're near the area, or just fly out, because many people do that as well. But you can call the office and schedule an appointment at 904-247-7455. Dr. Grable, it's always a pleasure to have you in the classroom as our teacher, and I'm looking forward to seeing what you have for us next month.
Good night.
Okay, so let's say goodbye to all the people in the classroom on Facebook. So we'll see you soon. We'll see you tomorrow. Bye. And you too.